Chiacchiere di Pancia, a cura di Chiara De Benedetti.
Hi everybody, welcome to this special episode of Chiacchiere di Pancia Podcast with Gronia. Thank you very much, Gronia, for being with us today. Thank you. How are you?
Thanks so much for having me, Chiara. I really enjoyed the last podcast we recorded, and I'm delighted to be invited back again and excited to discuss.
Yes, we have many things to discuss about because after the first episode we recorded together, I had many feedback and a lot of people asked me more information on one specific topic. And this specific topic is returning to running after pregnancy and running with diastasis because as we said before, there are no guidelines about it, and people don't know, women don't know what to do. They feel that they are in the recovery process after pregnancy, and they don't know what to do. They don't know how to start, and the result is that they don't exercise at all, which is something that we don't want to happen just because they are afraid to do something wrong or they are afraid to affect the recovery process after pregnancy or during the healing process of diastasis recti. So I know that this topic is is the topic of one of your last research, and I'm so happy to have you here today because I really like to go more into details to help people, and I'd like you to tell us something about this specific problem and this specific topic that women had to, go through after pregnancy and during their healing process of diastasis. But first of all, I'd like to tell you that, I am a big fan of yours, and I get a little emotional when I talk to you. So I'm very excited today, and I'm so happy. Thank you again. Thank you.
The feeling is mutual. I have a huge respect for you, and I love following your work. So yes, this is a great question, and it's a topic that I'm very passionate about because back in 2019, myself and some other physiotherapy colleagues, Emma Brockwell, who's a pelvic health physiotherapist, and Tom Goom, who's a musculoskeletal and sports physiotherapist, we came together and we had the same discussion as you've just mentioned there. There are no guidelines out there to help or inform women about how to get back to those higher level exercises such as running. So we did a little bit of a scoping review of the research, and we put together a self-published document which is available free to access in English if anyone wants it, and I can send the link to you afterwards, Chiara. And but from there we basically presented those at several conferences and put a call out for research. And thankfully, a wonderful colleague of ours, Dr. Izzy Moore from Cardiff University in the UK, stepped forward and decided that she wanted to help us to research this. So we recently carried out a study to investigate what factors either help or prevent women from returning to running after having a baby. And the things that we found were stuff that you've mentioned there, actually. Not knowing how to. So a fear of movement. A lot of women are very fearful that they might go back to running and do some damage or harm to their body. Another thing was vaginal heaviness. So that idea of a prolapse, feeling something coming down below, it appeared to be a barrier to women returning to running, whereas many of the women, so about a third of them in our study, were leaking urine, but they still ran. So a lot of women out there accept leakage of urine, which is something I also want to change. I want to let women know that while many of us leak after having babies, it might be common, but it's not something we have to put up with. But it was interesting because the women ran on. They must have put a pad on and just run. So we really want to highlight the key factors out there is that we need to be better at giving women information to help them get back to running so they don't fear it as much. And the diastasis one is interesting because in some research that exists there solely about diastasis, we've also identified that women are fearful of exercising because they're afraid of making their diastasis worse. But a colleague of ours in the US, Dr. Rita Deering, actually did a study with women postpartum returning to running who had diastasis, and she found that it actually was not harmful at all to return to running, and that the women had a reduction in their interrecti distance. So what I want to put out there is, for anyone who's worried about running if you have a diastasis, the research tells us that it's absolutely fine. You're not going to do any significant harm to that diastasis, but yet you're going to get out and get some exercise, which, as you know, I know you're a huge fan of exercise. Exercise is good.
Yes, yeah. That's what I believe. I strongly believe that it's very important to do exercise, to exercise after all life long. It's not just a matter of after pregnancy, before pregnancy, getting older, or whatever. It's very important to exercise until the end. I mean, I think so. I'm so sad when I hear about people having fear or doing something, but I perfectly understand that it's on the other side. It's very hard to find the right guidelines, and there are a lot of don'ts. Don't do that. Don't do this, because And so people say, okay, I stop. I won't do anything. Just tell me, what do I have to do? And the other thing is that running is very simple. I mean, it should be simple, but it's not, because some people don't know how to run. They are afraid that they're not able to run, which is incredible, because running is, I mean, it is born with us. Children can run.
Yeah.
We forget how to run. So, and it's very easy to exercise with running, because it's something that you can do anywhere and whenever you want. You don't need any tools. You just have to go outside and run. For example, here in Italy, it's quite easy, because we have this wonderful weather, and we can really
Just rubbing it in.
yeah. I think this is something that is very important to highlight.
I totally agree with that. And I love what you said there about running's very easy. I too agree that running's a particularly suitable exercise for postpartum women, because let's face it, any of us who have kids can all relate to the fact that it's really hard to plan. It's hard to sign up for and commit to structured exercise, because you might not be able to get out that day, or life gets busy, children get unpredictable. So running enables a woman to fit exercise around her lifestyle and decide when she has a window that's suitable that she can leave. And she doesn't need equipment. She doesn't need to have, any specific geographical location. She can just run where she is. But the only thing I will highlight is that not all women enjoy running, and so I think that exercise does have to be meaningful. It does have to be enjoyable. So it's about finding an exercise that suits you. However, because you mentioned about children run, all through our life we can run. Running is our survival instinct. So that's why I'm also passionate about getting women back to running, because if we're in danger, we need to be able to run. It's our fight or flight. So I'm quite passionate about empowering postpartum women so that they don't feel that they cannot run.
Yeah, totally. And what can we say to people, to women who want to run after pregnancy? Are there any steps that have to follow and they have to do before? It's not just like go and run. You have to, I don't know, test something or do some specific exercise before running or after.
That's a really good question, and that's exactly what we hope to answer in our the Return to Running guidance that we put out in 2019. And basically, when we trawled the research, one of the biggest things we found was that the healing process for postpartum women, no matter if you've had a really straightforward delivery, it goes beyond the 6 week time frame. Now, I'm not sure what it's like in Italy, but in the UK, there's this sort of magic number of the 6 week check that almost when you're 6 weeks postpartum, you're recovered, you're ready for exercise, you can do what you want. And really, we shouldn't be going on that so much. Everybody's recovery is individual, and we know that pelvic floor muscles are still showing signs of recovery up to about 4 months postpartum. We know that if women have had a cesarean section or abdominal delivery, that they're still showing signs of healing at the 6 to 7 month time frame. So we need to honor that. But to answer your question, you can't just do nothing for weeks after delivery and then to decide one day you want to go running. It's like the principles of any return to exercise. So if you're a sports person and during the winter season you aren't doing your sport, you need to have a period of training to get fit for performance again. And with women, I like to empower them to use the immediate weeks after having a baby to do strength and conditioning, nice graded, gently progressing strength and conditioning so that they're strengthening the key muscle groups that will be needed for running. So do the strength and conditioning, and that would be pelvic floor exercises, abdominal wall strength and condition, even things like getting into squats and lunges and nice closed chain exercises that are really going to help get the muscles firing again. When it comes to in our guidelines, with the research informing us, we recommended that women on average will require a period of about 12 weeks before they're suitable to return to running. Now, many listening to this might be shocked at that and thinking, I couldn't wait 12 weeks, or I returned at 4 weeks and I was fine. And for some women, they will be fine. But for the majority of women, returning too soon will increase their risk for pelvic organ prolapse or stress urinary incontinence or pelvic pain. So when it comes to you deciding whether you should return to run, whether that's at 6 weeks or 12 weeks, we have outlined some load and impact tests, which are a good process to go through to see can you do them symptom free. So the types of tests we include are running on the spot for 60 seconds, hopping on the spot on one leg, and doing things like forward bounds, which is jumping forward with two legs, which is quite high impact. So if you can do these series of tests and find that was no problem, I didn't leak urine, I didn't feel any heaviness or bulging in the vaginal area, I didn't experience any pain, it's probably a good indicator that you should try a graded return to run. And the emphasis is on graded there. We want you to potentially start with the likes of a walk run program. So you're not just deciding to hit the streets and run in 5 mile. You're going to see how your body responds to increasing the impact and build it up gradually.
Of course. Do you think there is a difference between women who used to run before pregnancy and women who wants to start running, out of the blue after pregnancy? I think there is a big difference between these two kind of population.
Yeah, funny you asked that. And I didn't mention it earlier, but in the research that we did, that research study that we found fear of movement and vaginal heaviness as barriers to exercise, we also found that women were more likely to return to running if they had a high running volume as their baseline. So the higher the running volume, the more seasoned runner they were. But also, really fun fact, if women continue to run during pregnancy, they were more likely to run after pregnancy and return to it. Whereas if women who were runners stopped running as soon as they were pregnant, it lowered their odds for returning to running. So one of the key messages we're trying to get out there as well is that exercise during pregnancy is absolutely beneficial and safe if the pregnancy is medically stable. Like if there's no concerns in your pregnancy, keep exercising.
Yeah, of course, you can keep exercising. And what about the fact, do you think that of course, the tests are either for women who didn't practice running before pregnancy, and either for women who did practice running after pregnancy? So you have to do the test just to know where to start. It's a good habit.
Yeah,
I mean, it's a good thing to do.
yeah, absolutely. Because no matter what happens, no matter how active we are during pregnancy, even if we ran into the late 37, 38 weeks pregnant, there will still be a degree of deconditioning around our body because we'll run differently, we'll move differently because we've now got a bump, our center of gravity's changed, we maybe are slower. And we're going to peak in terms of our exertion quicker because we don't want to overheat, we don't want to be too breathless while we're pregnant. So there will be reconditioning needs, and also depending on the delivery, there may be some degree of pelvic floor dysfunction or abdominal wall dysfunction or pelvic pain after the experience of delivery, because we know that women do experience trauma to the pelvic floor muscles and the abdominal wall. So like if you think of trauma in any other area of the body, if someone had a sports injury and experienced trauma, there will need to be a period of reconditioning and return to play testing. So in sports world, before someone returns to their sport, they do like return to play testing. And that's similar to what we're saying here. So it's really funny in many ways, because our research of finding that women were fearful of returning to running placed or enabled us to kind of compare women postpartum to return to sport. So we want the principles and the consideration that we give to sports medicine to be applied to women during delivery. And really, if we think about it, pregnancy and childbirth is a bit of a sport. It's an endurance event. So I think we need to honor it with the same consideration. Why should men who strain their knee or ankle get a significant period of rehab and return to play testing, and women go get pregnancies, have deliveries, and they get nothing? So we need to change that.
I really like the idea of pregnancy and delivering as a kind of sport. I really like this idea. I think I'm going to say it to my clients. Well, I'm not a midwife, but I know something about pregnancy, of course, because I deal with people, with women that have babies. And I know the fact about the 6 weeks that after delivering, the first 6 weeks are so important. I mean, here in Italy, that's the information that usually we give to women. And so I think it's good to have a recovery moment after pregnancy and then go into conditioning programs and then return to running and doing the test, of course. And I think it's very individual. We can say that 6 weeks the base or the time that we can somehow suggest to people, but maybe some people could need more time, and it's all individual. You have to trust your feeling, I guess. Even if when you go running, when you start running again, you have to trust your feelings and what you're experiencing while you're running. But do you agree with that? Because then I have the second question.
Yes, I totally agree with that. I think you're right, because I know that a lot of women who run usually really miss it during pregnancy and in those early weeks, and they're really, really eager to get back to running. So I understand it, and we don't want to stop women accessing that form of exercise that gives them enjoyment, that helps their mental health, that gives them their identity back, because that transition into motherhood can be quite life changing for women. They feel like they lose their identity in some cases, because life just gets turned upside down and you have a human being now that you're responsible for. So sometimes being able to get back to that running is really, really nice, because it's something that's part of you. Um, but yeah, I really, really agree with that. And I like how you say listen to your body. And if you're getting any symptoms of leaking, pain, discomfort, bulging, it's a sign that your body has more reconditioning needs, so that you need to kind of scale back and either do the rehab that you may not have applied yourself to fully, or access a health or fitness professional who specializes in this area.
Of course, and there are some steps that you have to follow. As we said before, it's not go out running 5 miles. You have to have. It's a long process. It's not that it's not so fast. And the question was, I don't know if you mentioned it or if you take into consideration this aspect, but according to your experience, how much the fearness can affect the exercise? I mean, if you are afraid of doing something, that's the moment that the exercise is not so how can I say? I mean, so safe. It's not safe because you have tension in your body, starting from your mindset. So the tension in your body could affect the exercise. So how much the fearness of doing something wrong can affect the exercise? I don't know if you have this you took into consideration even this aspect.
So
That
we
it's
didn't
more.
the when we did the research, when we found the fear of movement affecting it, that surprised us in many ways. It didn't. Clinically, we see that, but we were surprised that it came up so significant in the research study that we did. So that has now opened the question of, we need more research now to focus in on this and see how exactly it affects. So that has to be continued. But clinically, I will speak and say that the first thing that fear of movement impacts is it actually prevents women returning to exercise. So there's a population of women who just simply don't return to exercise because they're too fearful, and that has such significant and serious health implications because we need exercise for our physical and mental well-being. But for the women who do return but have fear of movement, I totally agree. They're going to be running differently. They're going to be holding tension, and they're also going to be zoning in areas that they're fearful of damaging, and they're going to be very aware of it. Like, a lot of women are not aware of any sensations down in their pelvic region or vaginal area, but when we have a baby, we have a whole new awareness and appreciation of that area because we know that we've just either delivered a baby or have some trauma down there. And it's really important that when the healing process occurs and that the tissues are recovered down there, that we don't have this magnifying glass over that region, zoning in and looking for things. And it's funny how the brain works. Basically, if we're worried about an area, we will be more aware of it. And I just want to put the message out there that exercise postpartum is safe. Women's bodies are so resilient. Yes, we are predisposed to certain symptoms of pelvic health like incontinence and prolapse, but many of us overcome these, and many of us get back to exercise symptom free. And for anyone listening to this, you can too. There's, no matter what way you are presenting, accessing the specialists who work in this area will mean that there'll be some option for you that can help alleviate those symptoms. So for some women, they may actually have to wear a pessary device when going running. I don't know if you've heard of pessaries. Pessaries support prolapse.
Oh,
They're like
yeah.
yeah. They're like little intravaginal devices that go in and they stop the prolapse or the walls of the vagina collapsing. So they are quite useful, and they totally alleviate any symptoms in women who find that rehab alone is not enough to get them back symptom free. But something that I also wanted to highlight, if you don't mind, Cara, was that as well as the load and impact test that we mentioned, and as well as considering the healing time frame postpartum women need to consider several additional factors that can also impact their ability to run. And that's things like sleep. How much sleep are they getting? What postpartum woman is getting a full night's sleep? Not many. And we know from sports medicine again that lack of sleep increases a sports person's injury risk, and it affects their performance. And so the same can be applied to postpartum women for that endurance event of pregnancy and childbirth that they went through. But also factors like psychological well-being. So some women need to get back to running to help their mental health, whereas other women may throw themselves excessively into exercise as a coping strategy when they're not coping really. So if women are overly exercising and to their detriment, that's something that we need to flag as well. And that's something that we need to ensure that women are getting the support they need. But also, have you ever heard of a condition called relative energy deficiency in sport, or RED-S? No?
Something, not that much, actually.
Okay, so it's a very technical term for anyone listening, but it basically just relates to an energy deficit. And postpartum women are high risk for this. So we're often getting up. We may have more than one child. We're getting kids up and ready. We're getting them fed. We maybe have had a poor night's sleep. We have to maybe go on school runs and things. So we're eating on the go and maybe nibbling and not getting good nutrition. And we just have a really busy day. We're not getting to recharge the batteries. And if we then decide to throw exercise and running into the equation, well, we may drain that battery. And by draining that battery, what can happen is it has an impact on our other bodily systems, such as our menstruation. It actually can affect our periods. So if women who have had their period return postpartum start exercising and find that their periods then disappear, it can be a sign that your energy levels are depleted. Another thing it affects is bone health. So those are the types of things we need to be also making women aware of, that they need energy reserves, they need good nutrition, they need to try and get it the best sleep that they can get, which is difficult in this period. And they also need to make sure that they are, getting help and support from their team around them or community around them.
Yeah, getting help, I think it's the key, because many women want to do all on their own, and they don't ask for help, and that is crucial. I think, as far as I remember, talking about my experience, I really needed help, especially with the second pregnancy, because I had the elder kid that she was needing attention, she was asking for attention. So, and I was busy with the other one. So, I mean, it was a tough moment for me and for every mom, I guess. I'm not the only one experienced that. And you have 4 kids, so you know better than me what that means to have a
crazy house,
a large family. Yes, I know it's crazy. So help, getting help, asking for help, giving help. Family have to understand that women need help after delivering. It's very important, and I'm happy that this. The mental issues are taken into consideration in all of these studies, because women need to know that they are supported in many ways. It's not just a matter of exercising, it's also a matter of mental being, that it's very important for themselves and for their family. I think it's a big issue. It's very hard to go into details, and it's very individual when we speak about something that involves your mind and your mental not even being. But the fact is that we have to talk about that. It's something that we have to highlight, because it's so everything is a part of a big picture that we have to take into consideration. And yes, there are many women who want to exercise because they are feeling better while and after exercises. There are other women who are afraid to do it, and we have to take into consideration all this. But the fact is that we need to talk about it. And I mean, no one talks about it. So I'm very happy, and I really want to underline that there are researchers, there are people like you who are taking care of these issues and these aspects. And I think all women will really appreciate that. Because they feel alone somehow. Every one of us felt alone somehow in some parts of our lives.
Yeah, and I think you're right that a lot of the issues women experience in this period of their life are issues that nobody talks about. Everyone tends to suffer in silence. And I think the more we do open the conversation about it, we realize that you're not alone, that this is actually something quite common that women are experiencing. So we know that women commonly experience postnatal depression after having a baby, and it's not surprising. Hormones are going through the roof and fluctuating. Sleep is zero. Like any of us, if we don't get sleep, that totally affects how we feel and affects our mood. And again, talking about that change in identity, particularly if this is your first child, you go from being someone who has your own identity, has your person, maybe has a role or profession, a job, they have their identity to others as a sister, as and different roles, maybe as a wife or partner. But becoming a mother is a whole new dimension, and suddenly a lot of it falls on the woman, and particularly in those earlier weeks and months, because you're the one who'll probably be off with the baby. You may be breastfeeding, which can make you feel a little bit more constrained and tied. And oftentimes it seems that the partners, their life goes on as normal. They go back to work. They still can do their social activities. And I do feel that it can be quite a challenging time. But something that I also want to raise is that many women actually experience what we call birth trauma. And that can even be if you've had a textbook normal delivery and you have a nice, healthy baby. And it can be something that they struggle to seek help for because they feel guilty that they're having feelings of a negative experience during childbirth when they're so lucky for them to be well and for the baby to be well. And what birth trauma is, it can be either physical, or psychological. So a lot of women go in with an idea of what they want their birth plan to be. So they may want natural delivery with no medication, and they want to breathe the baby out. The reality of it is, no matter who you are, I'm a pelvic health physiotherapist, and my birth plans didn't always go to exactly the plan I wanted, and we do have to be able to adapt to that. But if you're not prepared for a shift in how that delivery is going to go, it can very much seem like a situation that you've no control in. You can feel out of control. You can feel like you don't know what's going on. And that can be very traumatizing. So some women have almost what is like post-traumatic stress disorder after having a baby because of that experience in the delivery room. And if you're someone who's experiencing that, this is something that is quite common and you can seek help. Speak to your healthcare providers. Say that in the UK, we often have birth debriefs. I don't know if that happens where you are, Chiara. Do you have where the hospital might go through your labor notes and explain why it happened the way it happened?
Sometimes it's not that common. I cannot say that it's a common habit that we have here. We have to search a lot by ourselves, and we can find something. But we have to search. It's not something that comes to us. It's something that we have to look for.
Well, don't be afraid to look for it if anyone's experiencing something similar to this. And it's even if you had as I said, textbook delivery, you can still feel like you've had a traumatic experience, and that's valid. And it's something that you can be helped with.
Well, many women, they did their research on the web, so it's very important to find something like your research in the web, because it's something very, really, I'm sorry, I cannot find, it's something very, very serious that they can follow. And the other fact is that we know that sports and sport is one are the best medicine for depression. So this is something that it's need to be spread, because people doesn't know that. People don't know that. People they think about drugs. They think about take something to sleep or to have more energies, but they don't think that sports and sports activities can do that, and they are the best medicine for depression or anxiety or many aspects that we already know and we already discussed about it. So okay, so trying to not to sum up, but to give the right strategies, the right indication. What can we say to women who are listening to this episode? We can say that they need a moment of recovery after pregnancy, and then they can go back running if they want to. But first of all, they have to take care of their. They have to do some tests to be sure that they're ready to go out and run, and that this is a process that they have to go through. It's not something that happens all of a sudden. They just need to do it step by step, listen to their body and all the feelings that they are experiencing while they're exercising. And I think the other aspect, very important, is that they feel that they need it. They need to ask for help, and they need to ask for professional help. For example, a trainer, for example, a physiotherapist, for example, midwife, or the professionals can help them in the process and just to make them feel better. Because the goal is to be better, to stay healthy and mental health, thinking about the mental aspects and the physical aspects, of course.
Yeah, and as you said, we want to get women back so that they can continue running long term. We don't want women to get back running for a short term and then become symptomatic and keep having stop cycles. We want you to get running, enjoy it, recover fully. The way to liken it and make it really simple, if I had a calf injury and I stopped running because I pulled my muscle in my leg, when I go back running, when I take a period of relative rest and maybe do some rehab, then I go back running. If I was running again and started to feel a niggle in my calf, I wouldn't just go, oh, I'll run on. I would be like, oh, I don't want to injure my calf again. So I'll just pull back a little bit and do more rehab. And the same consideration really needs to be applied to pelvic health, because we want women to listen to any symptoms of leaking, prolapse, so that they realize that tells them that the load being placed onto the pelvic floor is too high, too much for what their pelvic floor is responding to. So it needs more strength and conditioning. Um, so there, and also considering all those wider factors. So if you're a mom and you have got back to running and you're doing okay, but you've had a really, really bad run of no sleep, you're feeling stressed, work or home life and getting all the kids up and out and everything is just very stressful. You're not eating that well. It may not be the best time to go for a run. You might want to wait until you've had a good night's sleep and feel a bit more refreshed and then think, oh, I'll go for a run tomorrow night or the next day.
Yes, you don't have to be obsessed by exercising. You have to do it for your health. It's not a matter of being forced to do something. So you can postpone your session the day after. It's not a problem. Yes, of course. Where can we find research? I will surely translate it into Italian because I want people to know, because there are anything about that here. So I'm really interested, for me and for my clients and for all the people who would like to have more information about that. So how can we find your research or the guidelines?
So I've actually recently updated my website so that I've everything linked that I've been involved in. So I'll send you the link or to that page, because it has all the research I've been involved in, including the free to access publications such as the Return to Running Guidelines. And it has the nice infographics, which you're going to translate into Italian. So there's infographics that will soon be available for women based on the guidelines. So that'll give a nice snapshot. But yes, and I have a couple of blogs and different things that we've wrote on the guidelines that are available on my website too. So I'll link those.
Okay, I will put the link on the caption of this episode so people can read them, and I will translate all that I can, just to make people to make easy for people to access the information. Because this is something that I really care about. It's something very, very important, and it's so precious at the same time, because as I told you, it's very hard to find the right invitation. I want people to know the right stuff as much as possible, and exercising in the best way for them. And okay, and what about you have a lot of activities, so would you like to mention something about all the activity? You do a lot of things, so it's very hard for me to to do the list of all the things that you do. But if you'd like to mention something about your professional activity, please let us know.
Yeah, so I'm still in clinical practice. So I run my own clinic here in Northern Ireland, but I'm also doing various bits of research. And my current research study that I've just enrolled for is actually investigating. It'll be relevant to runners actually when we get the results, but it's investigating whether compression garments, so like sports bottoms, leggings that have some targeted compression for the pelvic floor region, it's investigating whether they have any mechanical impact on the pelvic floor. So I want to see what's happening so that we can inform future practice. I'm also still doing my podcast with Emma Brockwell, and we hope to have you on it. So I'll be talking to you about that soon. And so if anyone wants to know, that's linked on my website too. So you can see different sessions we've done. They're all in English. Apologies, I'm a one language person, which is very shameful at this stage in my life. So I need to learn a language. I must do that.
Which
Italian.
one? You already speak Italian. Okay, it's okay for me, but I mean, you speak English. That's the best language in the
Oh, but
world.
that was so no.
You,
I need to expand my horizons and be able to communicate with
okay,
people.
you can speak Japanese. You can try to learn Japanese.
I should try that. I'm trying to think what else I'm doing. I'm still doing some education and teaching. So if anyone's a health or fitness professional, I have an online course on diastasis rectus abdominis, and I have a patient or public facing leaflet on diastasis. And yeah, I'm doing more workshops and things and teaching and enjoying all I'm doing.
Well, the professional trainings are so important because professionals need to be aware of the fact that if there are issues after pregnancy or with diastasis, the training program must be, built around these issues. It's not like taking something from there and picking something from other techniques and put it in a training. You have to do something very specific. You have to know the issues, all the issues related with diastasis and more. So it's really important. The professional trainings are very useful for people who want for trainings who have people with diastasis, who deal with people with diastasis. It's very important to know all the issues related, especially and including the psychological ones, because it's very important to be empathic with the clients I have in front of me. I have to be very. It's natural for me, but it's very important to this kind of empathy with people who's going through something that cannot control, like a diastasis.
Like we cannot look at people in separate entities. As you say, we're one whole system, and how we feel and how our psychological well-being affects how our physical well-being is, and vice versa. So we have to look at people within that biopsychosocial context. So I love that you said that. I totally agree.
Thank you very much. So tell us again, please, your website. I already put it on the first episode we recorded together, but I'd like to put it again so people can find you.
www.absolute.physio, and that's it.
Okay, perfect. So I don't know how to thank you again. I remember I said it the last time we met, and I'm saying it again. Thank you very much for your support and all the informations that you shared with us. I will keep on following you, as you know, and then if people want to know something more and they want to write me or send me an email, they know that they can send me an email at chiacchiere di pancia@gmail.com, and I will be very happy to answer, and maybe I will call you again.
Yeah, thanks so much for having me. And I love that you're raising these topics and increasing the awareness of everything like this. And I'm a huge fan of your work. So, yes, let's keep in touch and chat soon.
Thank you. Ciao. Ciao, ciao.
Chiacchiere di pancia, a cura di Chiara De Benedetti.